You know, if you have your dogs trying to hurt each other, that's really upsetting. And your first impulse is to yell at them to stop and then reach in and try to break them up. And neither of these approaches is going to be helpful, not in any long-term way. You've absolutely got to have a strategy, a long-term strategy to deal with this dangerous problem. In case we haven't met, I'm veterinarian Dr. Jeff Nickel. This is Miss America, our family border collie, and this is Gaston and Tony. I'm residency trained in veterinary behavior medicine with many years of experience in general practice, including emergency work, suturing up a whole lot of these wounds that are much more sometimes than skin lacerations. Well, I don't have to tell you that it can be really, in fact, life-threatening in some cases. And I'm not going to suggest that dealing with these things is easy. Some of them have got very good outcomes and some of them not so much. And it isn't caused by the pet parent, but it is certainly something that, as a leader, the person in charge has a lot to do with success or failure. So, let me ask you first, by the way, if you can hear me loud and clear, would you send me the wow button? And if this is information that you find helpful, hit the wow, hit some hearts. Thank you. And tell me that you're here and where you're from. I do these things because I want to help bring out the best in pets and their people. And the most common problem that we see in a veterinary specialty behavior practice like mine is aggression between family dogs. And in fact, lately I've been getting even more of them than usual. So I thought I'd address this problem, and at the end of this Facebook Live, I'm going to have some another thing that I'll offer to help people. So let me get into a story that would be valuable to illustrate some of the issues around this problem. The names have been changed to protect the innocent. So, two folks in this home, Jenny and Harry. Jenny's there full-time, and in fact, with stay-at-home restrictions from COVID-19, she's there pretty much all the time with her two St. Bernards. And Jenny's not a particularly big woman, and these dogs are, well, they almost outweigh her, and pound for pound, of course, they're stronger than any of us. So her husband is Harry. Harry also has a place in Wyoming, and so he's gone sometimes for 5 months at a time. And that change in the household for these dogs is probably a factor. So two dogs, Harpo, he's the neutered male St. Bernard, about 6 to 7 years old, and the other is Sammy, and she's about 5, spayed female. Well, one of the most important things we do in behavior medicine is evaluate what's going on with everything else in the body, in addition to the brain, where all the behavior starts, because medical problems elsewhere are very often a significant impact. And as it turns out, Harpo has issues with his ears. Now, his regular general practitioner, Dr. Chavez, examined his ears recently and found that, yeah, they were infected, but not major. But during my exam and consultation of these dogs, it came to light that not only had he been scratching his ears somewhat, that he'd been chewing pretty vigorously on one paw. So what's that got to do with aggression between these two dogs? Well, I thought you'd never ask. So, Jenny, the female leader, the pet parent, home full-time right now, she acknowledged that she's been pretty darn tense lately. And, you know, our schedules have been thrown off. I mean, let's make a statement of the obvious. And there's a great deal of human anxiety. It is not so simple to say that these problems are caused by human emotions, but that is an influence on many behaviors, not just this one. And when her husband, Harry, pardon me, when her husband Harry had been home for several months at a time, Harpo, the male St. Bernard, had become quite attached to him, to the extent that Harpo was following Harry from room to room. And so when Harry moved back to Wyoming for that 5-month stretch, that really kind of upsets the sense of routine, the predictability that's so important to a lot of dogs. And we see that as an influence on separation behaviors in some cases, but those are anxiety-driven, And this problem, in the case of these two dogs, is anxiety-driven. It isn't in every case. This is one particular situation that I thought might help illustrate some of the problems. So since Harry had left, Harpo then switched his over-bonding, I think to a degree, to Jenny, and followed her around the house. Well, Jenny's one of these people who feels that it's essential that she give equal attention, equal rewards, equal treats to her dogs. And it's understandable how people come to believe that, because, you know, we love them like little children in furry suits, don't we? And, well, that's good for all of us. But the issue is, of course, that these are, unless you have puppies, our adult dogs are not children, and they're members of a different species. And so many of the rules are quite different. And so equality is not the issue, because they are so big on living in the moment that they never compare notes on who got what. They have a hierarchy, and the higher status dog has first, and in some cases only, access to the high value resources, in this case food. So when she had this habit of giving them equal amounts at exactly the same time, believing that that would be seen by the dogs as being equitable, that's not a factor for dogs. What really is important to them is who gets it first, because they're all sure that that famine is going to start in about 20 minutes. So mistake on Jenny's part. She didn't know any different, but that food issue, competition for that high value, and in the dog's mind, scarce resource, can be a very big motivator for competitive and, in some cases, aggressive behavior between them. So during the previous 10 days before she brought them in, and she only came in with them last week, Sammy had rushed up to Harpo often when he was approaching the food bowl. She had the other habit of leaving food out all the time for her dogs to snack on whenever they wanted. And, oh, Jana, thank you for coming, and thank you for letting me know that you're here. Well, our human logic, I happen to know that Jenny makes a good income. She's been active in her profession for many years. Lady's not going to go broke. So she'll always have plenty of dog food. And so we look at our dogs and think, well, of course they know that. There's always been plenty of dog food. They've never been in short supply, so surely that can't be an issue. Oh, it is the issue. Dogs are programmed for scarcity. It's one of the reasons, in fact, one of the principal reasons, gentlemen, we need a little bit more cat food in our indoor hunting feeders, Carolyn, because the natives are getting a little restless here. This isn't about cats, but they make it about cats, don't they? So thank you very much. Carolyn will keep us supplied. Oh, wonderful. There you go. Here you go, gentlemen. So where the heck was I? All right. So our dogs, they're programmed for scarcity. It's how they survive in the wild. They're foraging and scavenging almost all the time. So they carry that same innate behavior into our homes. Forget that you don't have any issues with supplying good food for your pets. They don't know that. Dogs are sure that that meal might be their last. And many dogs in many homes don't have a problem because they're pretty well adjusted and they roll with the punches and they go, gee, this is a little weird. Maybe the food will run out, but I'll be respectful of the other guy, and that's not necessarily a problem. But in many homes it is. And I strongly urge everybody to feed their pets separately, because that way we simply aren't going to have food-related aggression. We'll get to that in a few minutes. So anyway, food's always available, and so here's Harpo. He's at the food bowl, and Sammy runs up and kind of menaces him with their body signaling. And that body signaling is really important because dogs are highly communicative, and they don't miss anything. And so here's Harpo, and he's a guy who has been, backing away, allowing the higher status dog, Sammy, to have her way. But she continues to come up and not only threaten him at the food bowl, but she comes up real close to his head and puts her nose right at his ear because it has a funky smell, because it's inflamed and infected. Dr. Chavez said it wasn't a big deal. She's the doctor in charge, but I have to tell you that if that is a trigger for this dog, it is a factor, and apparently it is. It's not the only factor, but it's important. And, oh, Deborah, I've always supported the natural hierarchy of the pack. Nina gets everything first. Yes, Deborah, actually, I've treated her pets. Oops. And a canine social group, not identical to a wolf pack, but there are similarities. But you absolutely must support the hierarchy because you're going to keep the peace that way. The idea of championing the underdog and making sure that the lower status dog doesn't get pushed around, you're actually messing around with Mother Nature, and you might be asking for trouble. And in fact, Jenny was guilty of that, didn't know any different. It's my job to educate people, but that's what I'm doing right now with everybody who's watching this. So anyway, Sammy comes up to sniff Harpo's ear, and he leans back and he gets tense, and she's reacting to his body signaling, and she gets more agitated, and then she immediately lunges at him. And this has happened multiple times just in the last couple of weeks. Well, of course, right away, again, this is highly upsetting to any dog parent, and Jenny just jumps in and yells and shrieks and tries to separate these 110, 120 pound St. Bernards, and she gets bitten. And it's happened more than once. And that's called redirected aggression. Neither dog had any intention of injuring this lady that they love, but it isn't about Jenny. It isn't about the person. Had she stuck a broom handle in there, or a dining room chair, or her hand, whatever it is that obstructs the dog's access to the target of its hostility, just might get nailed, because the dog is highly agitated, highly focused, and if something stops it from reaching its target, it simply redirects that same aggression to whatever it was. And people have become horribly injured sometimes reaching their hands into a dog fight. And I'm going to show you something else here in a few minutes. There we go. A basket muzzle. We'll talk about this a little bit. But if you are at all concerned that your dogs might fight, they should each drag a leash attached to their collar, much better than to a harness, and they should drag it around 24/7. We'll call it a drag line because they drag it around. And if you have a problem, you remain silent, because any histrionics on your part only ratchets up the intensity of the arousal that your dogs have, and they become even more intensely agitated in the context of being with the other dog and with a competitive trigger, such as food, many times attention from a leader. So you remain silent and grab a drag line, a leash, and separate your dogs. You never reach into a dog fight. Well, of course, Jenny did it a few times, and she's paid the price. No severe injuries, but I have seen them. So this happened a few times, and she thought they'd be okay after I told her, look, don't even let them see each other, and of course it happened all over again. So we've got a pretty big problem here, haven't we? So here's my diagnosis, and there were other factors here, but that Sammy, the high-ranking dog, the female, has an anxiety-related reactivity to the scent in Harpo's ears. It's not that the scent of the inflammation and maybe the discharge in there caused her to be aggressive. She already had a problem with him. She was already an anxious dog who would react to almost anything, and believe me, the history is full of situations where she just reacts because, as Jenny put it, she's often hypervigilant and nervous, and has been for years. But now that her person is home more, you'd think she'd be more relaxed, but it's a change. And because her leader is a little bit anxious about the change in everybody's life, her dogs are following her emotions. And so everybody's ratcheted up. So some little thing like a funky scent in the other dog's ears has Sammy becoming reactive. And sometimes when she comes to Harpo and he gets nervous, she reacts to that. And there's no substitute for being a very close observer of what's going on among your dogs. And videos, of course, that you can show your veterinarian or your other qualified behavior consultant. Those things can make a huge difference. So the real honest-to-goodness diagnosis that we were clear on with Sammy was that she had food-related aggression. She would run right up to him when he was at the food bowl. Redirected aggression toward her person, towards Jenny. And she also had generalized anxiety disorder. Through her life, she started out being anxious in response to particular triggers as a younger dog, And as the years went on, that list grew and it became generalized to other situations. So you have a dog who is anxious in a growing list of different contexts and situations. And as Jenny put it, she was seldom relaxed. So what are we going to do about this thing? Well, there isn't any one treatment. You know, the more complicated the behavior disorder, the more frustrated and upset the pet parents are, the faster and simpler they want it solved. And isn't that the way we are, especially we Americans? You know, we have about that much patience. We want problems solved 10 minutes ago. I get that. I've got a problem with patience myself. But that's not the reality, is it? In fact, to deal with this thing, we have to parse apart every detail and influence we can, and we've got to do everything we can to improve the quality of life of these dogs and their person, and set everybody up to succeed, including the dog parent, so they've got a decent shot at improving. Now, here's the good news about Harpo and Sammy, is that as many times as Sammy has grabbed Harpo and pulled on his hair, she's never injured him once. And as frightened as he has become of her, thank you for those hearts, by the way. I'm glad I'm doing something valuable here. And as frightened as he has become, he has never crossed the line of becoming defensive aggressive. And we see that pretty often too. In fact, it's sometimes the lower status, highly frightened dog who just loses its mind with fear, just becomes overwhelmed with self-preservation, that's the dog who's doing the biting and injuring, when in fact it may not be the true instigator of the problem. Well, in this case, Harpo, the lower status male St. Bernard, did not fight back. All he wanted to do was get the heck out of there. In fact, sometimes ran away from Sammy crying. And Sammy, that seemed to ratchet her up even more, and she would go after him and growl and snap and bite and get hold of that thick fur around his neck, but never caused an injury. Now, Jenny felt that, well, you know, she would have, but for all that thick hair. No, that does not prevent injuries. I can tell you from having sutured up so many of these wounds, it doesn't matter how thick the hair coat is. That does not slow down a bite. And you've got these great big dogs especially, and the bite force in their jaws is tremendous. No, the reason that Sammy, the female, never injured Harpo was because she kept pulling her punches. And that's the good news. Doesn't mean she always will. And as much as Harpo was successful in escaping a lot of the time, it doesn't mean that at some point he might just crack and say, oh my gosh, I've had it. I'm going to have to bite this other dog or I'm going to get killed. So we could be right on the very edge of a major disaster here. But so far, we haven't crossed that line. And when there is physical injury, that really does cross a really unfortunate line, because now we have pain added to the emotional stresses that trigger the aggressive events, the hostility, the competition, the anxiety, the fear, and then you add pain. We don't have that yet with Harpo and Sammy, fortunately, okay? So this is what we're doing. We're putting everything we can into this thing to get everybody back off the ledge on this thing. So one important thing was that when these dogs are in the presence of their person with Jenny, they are noticeably more agitated. Well, she is. And I made her aware of that. You know, I'm qualified as a veterinary behaviorist because I've done a residency, but I'm not a psychologist of people. And so and that's not why she came to me, so I'm not going to give that unsolicited advice. But I made her aware of it. Also, I made her aware that Harpo was becoming increasingly frightened. And so, never ever reach into a dog fight. I can't emphasize that enough times. And the most important thing you can do at the moment is ignore. And you may have heard me say that before. We know we've got plenty of research to indicate that dogs regard every response from a leader as a reinforcer for their behavior and their emotional state of the moment. So if you want your dogs to be frightened, aggressive, anxious, you name it, then respond. Well, obviously you don't. So a good canine leader does not respond when he or she sees unhealthy behaviors. Okay? So my, whoops, there we go. Oh, Cindy, you're here. And Leon, hello, thank you for coming. So you ignore. Now, you've got to do something, right? What you don't, whatever you do, you don't want your dog to somehow misinterpret that it's just been reinforced. But you have those leashes attached to their collars, those drag lines. So you ignore and immediately grab one and create distance, okay? And with greater distance, there will always be less arousal. You've got to absolutely do that. Another essential of this thing is that food-related aggression must be completely out of the picture. And there is only one good way of doing that. There are 2 feeding times per day, morning and afternoon, approximately the same time every day. Dogs love to have predictable routines, especially when there's an anxiety problem. So here's morning time, and you keep those food bowls, by the way, out of sight in a cabinet, door closed, because some dogs will associate a clean but empty and available bowl. They associate that with food, and the other dog comes near it, and that can spark a conflagration. So we take that out of the picture. Those food bowls are up on a shelf, out of sight, and so you say, all right, feeding time. So we put Harpo in his feeding room, same one every time, close the door, he's in there, and then take Sammy, put her in her feeding room, close the door. Now we've got 2 isolated dogs. Then the person, the pet parent, goes to the cabinet, pulls the dog food bowls out, measures the food into them, and then you go to the first dog's feeding room, you open the door, slide the food bowl in, close the door, and then grab the other food bowl, go to the other door, open that, slide the food bowl in, and the dogs have lots of time to eat, 10 minutes, whatever it takes. And then you say, all right, pretty much everybody's been done eating, so I'm going to pick up those food bowls. Those dogs had no business being together yet. So they're still in their feeding rooms. You open the first door, take out that food bowl, close the door, that dog's still in there. And then you go to the other room, and however many pets you have, and you open that door, take out that food bowl, close the door, they're still isolated. You take those food bowls, clean them up, stack them, put them up on the shelf, close the door, and then you let those dogs out. So when they are together, there's never anything remotely resembling food toys, bully sticks, rawhide chews, greenies, anything that they might look at and go, oh, that's the last bite of food on the planet, and I'm going to have to fight and kill for it. Again, so many of these aggressive dogs have anxiety problems, and they overreact because they're highly tuned up, they're highly agitated way too much of the time, which is certainly the case in this home, particularly with Sammy. Okay, so take that out of the picture. Now, Dr. Chavez is a good general practitioner. I know her. She treated those ears, but there's more going on with Harpo. He's not just got this smoldering infection, which is not way out of control, but he's also got an itchy paw that's driving him a little bit crazy. Now, the ear canals, the tissue in the ear canal is an extension of the skin. And the biggest reason that ear infections are one of the most common problems seen in general veterinary practices, and believe me, in all my years in general medicine, I've treated a whole lot of ears. One of the biggest reasons that they occur and reoccur in many dogs is that the dog is allergic and scratching and is actually upsetting the balance of organisms inside the ear by scratching. So this dog's skin really needs some attention, including its ears. So I referred Jenny to take Harpo to the veterinary dermatology specialist who would really uncover this thing. I happen to work with her in the same specialty hospital, and she's really good, very thorough. I want that problem put to bed. It isn't the only cause, but it is a reason for Sammy to rush up to Harpo and get agitated. And then when she's ratcheted up one more step from that agitation of smelling that funky odor, that's when she strikes. So let's get that off the table. Not the whole thing, but that's an important part of it. So we're taking food-related competition out of the picture. We're taking the skin issues, the discomfort. Besides that, hey, Harpo needs to feel better. If he's licking that paw and scratching that ear, let's get him over that hump. Okay? So in the near term, I told Jenny that these dogs should not see each other. And we want them to stop associating hostility and fear with being together. We need those memories to fade. So she needs to manage them so that they just don't see each other at all. And in some cases, we do that for a few months. And you think, isn't that a little bit much? Oh, listen, I got to tell you from so much experience with these cases, is that if we let these problems repeat, then the injuries start coming fast and furious, they get worse each time, and we come to a point where we cannot win these. And people have to part with one of the dogs they love, rehome it, or, they can't live together. And that's the worst thing in the world. So we've got to treat these things as early as we can, and by preventing them from seeing each other, we have a shot at improving what's going on, and when they reintroduce them very carefully, under my supervision, can set them up for success. So what about that underlying anxiety that's such a big problem for Sammy? And believe me, it is a huge problem. It is a huge cause of what's going on. And so I'm not going to treat Jenny's anxiety problems. I'm going to let her handle that. But I'm certainly going to urge her very strongly to allow me to prescribe any treatment that's going to help. And so I prescribed a medication called fluoxetine. Fluoxetine is an anti-anxiety medication, and that's the generic name for Prozac. Widely prescribed antidepressant in humans. Has mighty good anti-anxiety benefits in most dogs, especially when the anxiety is manifest by aggression. So let me read you just a little bit of the abstracts from a couple of research studies that help make the point. This one is called Assessment of Serotonin in Serum Plasma and Platelets of Aggressive Dogs. Serotonin is a neurotransmitter, and we know that greater levels of serotonin are clearly associated with lower levels of anxiety, especially aggressive manifestations of that. And fluoxetine raises the level of serotonin between neurons. And I'm not going to read you the whole thing, but the serotonergic system, that is how we produce and how we maintain levels of serotonin, is believed to play an important role in modulating aggression for pretty much all of us. And this was a study done in dogs, but they've had very similar research done in people with problems with violence. The mean serotonin concentration in aggressive dogs, and they did a study in a big group of dogs, was significantly lower than in non-aggressive dogs. In other words, the aggressive dogs in this study had lower levels of serotonin. All right, here's another one, very brief. This one is called Efficacy of Fluoxetine for Canine Behavior Disorders. The objectives of this retrospective descriptive study were to compare the efficacy of fluoxetine in conjunction with a behavior modification plan, and we need that, for the treatment of common canine behavior disorders. Overall, 59% of owners reported that their dog showed improvement after taking fluoxetine. 32% reported no appreciable response, and 9 reported negative responses. In other words, those dogs actually got worse, 9%. My experience, probably not that many, but medications can have a paradoxical response where the pet gets worse instead of better. We have lots of medications we can add in for serious anxiety disorders. And so if one doesn't do the job the way we want it done, we have other choices. You can tell 59% of them improve significantly. That's pretty darn good. But that's not all of them. These things are complex, and in some cases we'll add other medications in to reduce the release of adrenaline, to diminish the explosive nature of these. If we see side effects, they can occur. Usually it's lethargy, sometimes poor appetite. Then we're either using the wrong medication or the wrong dose, and we make another change. But this is such an explosive and dangerous problem, and not just for the dogs that Jenny loves so much, but it's dangerous for her too. And this is causing this poor lady significant distress. So we do what it takes. We're not going to leave anything untouched because we want to improve everybody's quality of life. So I hope this has been helpful, and if anybody has any other questions, you can put them in the comment line right now. You can tag your friends. If you know people who may be struggling with this kind of thing at home, by all means tag them. This is going to be available on my Facebook page, and so you can share this with anybody you like. And this coming Monday, that'll be Monday the 18th, at 1 o'clock Mountain Time, which would make it 3 o'clock Eastern and noon Pacific. 1 o'clock Mountain Time, I'm going to do a 1-hour virtual conference on Zoom. If you haven't used Zoom, it's so easy. I'll explain that in a minute. And people, there's going to limit it to just 4 people or 4 families with their pets, so that I can gather specific information about each situation and address individually each person's issues with their dogs. And there's always commonalities. There's always things that people learn from what I'm discussing with others. It is not the same as an individual one-on-one consultation. I spent 2 hours on those. But this is much, much less expensive. This will be $60 per family. And if you call my office and the phone number, and let me put this up here for you so that if you want to, you can copy this down. Virtual conference. There's our phone number, 505-792-5131. That's Monday, May 18th, 1 p.m. Mountain Time. I'll hold that out there just a little longer if you want to see that and write that down. And you can call my office, and Carolyn can put you on the schedule. And what she'll do is send you a Zoom link. And it's so simple. We send it to you in an email, and then at 1 o'clock Mountain Time on Monday, you simply click the link, and you're in. You are part of the virtual conference. And we'll all look at each other. But if you don't want your picture on, you don't have to do that. It'll give you the option of not doing it. And so one of the other things, by the way, that I'm going to do for anybody watching is I will post on my Facebook page later on this evening some information on food-related aggression. That same structure I described for avoiding the problem, I'll put that in Facebook so that you can, I'm sorry, it's $50? Oh, pardon me. Carolyn said it's $50 on Monday. So there you go. You already got a break in the cost. So, and let's see. I've got a question here from Gloria. Hello, Gloria. I haven't talked to you in a long time. Glad to know we weren't the only ones out there with these issues. Great to see you, and hope you and your family are well. Gloria and her husband Bob were clients of mine for years with their wonderful dog Max, and he did struggle, and we did make improvements. But he was always a challenge. But they loved him, and he lived a good long life. I think it was 13 when he passed on. Well, so Gloria, wonderful to see you again. You know, when people's pets pass on, they don't live long enough, and then I don't get to see their people anymore. I miss them because people become my friends. So excellent to have you check in there, Gloria. So any questions, you're always welcome to post them on my Facebook page. And I invite you to subscribe to my website. It's Dr. Jeff Nichol, Dr. Jeff, Nichol, and that's my web address. And you can subscribe. You just go to the bottom of the homepage, and there's no cost to subscribe. But if you do, every Tuesday morning in your email box, you'll get my weekly Facebook Live, so you don't necessarily have to watch it on Facebook. And you'll get my weekly, what we call the media blog, which is really my question and answer column I put in the Albuquerque Journal the week before. And so you'll get that information every week. It costs you nothing. And by the way, when you do subscribe, I will also send you at no charge my at-home pet first aid and CPR guide, which are bullet-pointed, easy to use, and they're worth printing out and sticking to the fridge or some other handy place, God forbid, in case something happens to one of your cats or dogs. So thank you so much for tuning in. It was just wonderful to share a little time with people and to give you some good information. You know, I'll tell you one of the things that I like best about behavior medicine is that there are so many parallels. They're not identical, but some life lessons that we can take from this. You know, the avoidance of the arousal and aggression triggers in a case like this not only prevent these dogs from ramping up and rehearsing these neural circuits in their brains that deepen the memories and speed their unhealthy reactions, but by abandoning them, in this case, these two dogs, Harpo and Sammy, not seeing each other for a while, allows them to abandon these things. Many people feed their dogs at the same time. They give them attention at the same time when they've already learned that the dogs are going to compete and fight for first access. Well, and then they try to scold the dogs, reprimand the dogs, and try to require the dogs to do something that's essentially impossible for them. So avoidance of arousal triggers, avoidance of severe problems, boy, we just have no business trying to slay every dragon that comes along. we've got dogs who are having a really hard time, and we need to make it as easy for everybody as we can. So avoidance really matters. And in humans, I don't try to wrestle every problem I have to the ground. If it's not necessary, I let a lot of things go. And the older I get, the more I found it. Don't sweat the small stuff. And rule number 2, it's almost all small stuff, isn't it? If not all of it. So there are lessons that we can take. You don't have to fight everything. You can avoid some things, and in fact we should. And our pets, their lives are better. So thank you again for sharing the evening with me, and I hope everybody stays safe and healthy, and wear your mask in public. I'm at home right now, so I'm not wearing it. And everybody have a good weekend. Thanks so much.